Hi, I'm Alan Murray, the CEO of Fortune Media, and I'm here today with Sarah London, who is CEO of Centene, one of the giant healthcare players in the U.S. It's number 25 on the Fortune 500 list, and also just earned a spot on Fortune's Best Workplaces for Women list. Sarah, thank you so much for being here.
Thanks for having me.
So talk a little bit about what it takes to get on Fortune's Best Workplaces for Women's list.
Well, we've done a lot of work at Centene around our culture. We try to be very thoughtful about listening to our employees and making sure that we're creating an experience for them that meets their needs and makes it a place that they really want to be. And we are really trying to build a culture where everybody has a voice and really emphasizing having a diverse workforce and making sure that our workforce mirrors the customers that we serve. And so we have today 77% of our workforce are women, and the best ideas come from that level of diverse experience and opinion. And whether that leads to better service for our members or, frankly, better ways to serve one another as an employee base. So we have a number of employee inclusion groups that come together and bring forward recommendations for how we can support our employee base more fully. We recently had the recommendation to expand our caregiver maternity-paternity leave, which was something that was near and dear to my heart. A little over half of our members are women, but it's actually more layers of diversity, so not just gender, but thinking about the fact that serving 28 million Americans, we're in 31 states for Medicaid. We are in more than 2,000 counties. That inherent diversity, having that embedded in our workforce, makes us better listeners, better designers to serve our members better.
Because we've been talking about diversity, but health equity is really at the core of what you're trying to achieve. I see numbers all the time that maternal health care, for instance, for lower income women in the United States is worse than any other advanced nation. Why is that so, and what are you doing to change it?
So I think part of it is the need to, first of all, acknowledge that is the case. Second, recognize that the answer to that problem is not to just pour more dollars into health care. It's really to think about what are the factors that ultimately influence mom and baby. And a lot of it has to do with what's happening in the community and then figuring out, okay, how do you activate that community? And then what are the resources that go to that? We have a community of Salvadorian members who, as part of their cultural practice, quarantine for 40 days after they give birth. Wow. And so they're not getting in for postpartum care. And that's just part of their culture. And so the healthcare system's not thinking about that, but we can figure out how to actually send nurses into the home or do telehealth follow-up visits and create a healthcare system that works for them. And the math works. I would argue we've been sort of demonstrating not only that health equity is critically important and that it is a driver of health outcomes, but that you can efficiently spend the dollars to improve health in a community.
Running a big healthcare company like Centene, what can you do to affect all those social determinants of health, housing, transportation, access to food, access to open space? I mean, how can Centene make that better?
So we have the flexibility to put our dollars to work in the community against those efforts. We hire people from the communities we serve. They live and work in those communities. We know what are the resources that are the best. In Michigan, we've partnered with the Greater Michigan Food Bank. They serve 30,000 meals a day, but they have this really cool thing called the Park It Market. So think about people who are in food deserts who can't actually get to a grocery store. So when you hear the buzz about food as medicine, that's actually food as medicine. And a lot of those resources are already in the community, and some of them are publicly funded. And so that public-private partnership to say, let's not recreate the wheel, let's figure out who's already doing this really well in a community and bring it forward.
Sarah, every CEO I talk to these days in every industry tells me that we are on the cusp of a technology revolution. I know you have a technology background yourself. Can you talk about how technology is going to transform healthcare for this group of customers?
Healthcare in many ways is like the last frontier that has not truly gone through a technology evolution or revolution. And we're at a moment now where I think the pieces are in place. The installation of the electronic health record means greater ubiquity of electronic data. So you can start thinking about transacting in a more efficient way. And that's where some of the generative AI, I think, is going to have a huge impact in the short term, because there aren't really regulatory issues to battle with there. It's just, can we pay claims faster, answer questions faster, create self-service so members get what they need faster, better, cheaper. And so that, I think, is going to be, over the next couple of years, a really exciting place.
So Sarah, look 10 years down the road on this key issue of health equity that is at the core of Centene's purpose and at the core, I can tell, of Sarah London's purpose. Where are we going to be 10 years from now?
So I hope that we are in a place where we design around an insurance product and around the healthcare delivery product is integrated across the dimensions of what actually drives the health outcome. And so what does that mean? We are actually allowed, in the dollars that the state gives us to spend on our members, to fully contemplate where those dollars are going to have the greatest impact for every individual's health outcome. And that's how we do the math. That's how we do the input math. That's how we do the outcome math. We fundamentally start to see better health outcomes for our members, but for Americans.
Sarah, fascinating and important discussion. Thank you so much for taking the time. I look forward to talking to you 10 years from now and seeing how much progress you've made against those ambitious goals.
Well, thank you. So do I.